honored to have such an esteemed gathering of professionals with us today from industry, hospital, and academics. On behalf of KrupaNucon College of Nursing and the organizing committee of this webinar, I, Rajrajeshwari, lecturer from KrupaNucon College of Nursing, take this opportunity to welcome you all for this second series of International Pre-Conference Webinar 2K24. The topic for today's webinar is Virtual Reality Simulation, a transformative tool for clinical excellence in nursing. Technology is continuously evolving and expanding. In the nursing field, technology has become essential for taking vitals, inputting electronic medical records, and even using simulation training. Nurses rely on the advancement in the equipment and technology to successfully perform everyday tasks. Simulation training is one of the most essential technological advancements for the nursing profession. Nurses use simulation laboratory training while in nursing schools and throughout their work field. Simulation laboratories are specialized labs that have controlled computerized patients that are capable of exemplifying different humanistic reactions and response such as overdose, cardiac arrest, and even respiratory complications. These specialized training allow nurses to develop new competencies in patient care and demonstrate new evidence-based care technique with the computerized patient before performing these competencies on the floor of actual patient. Nurses are continuously going to encounter simulation training in order to aid their professional development with patients. Simulation training strategies can be used alone or even with affiliation with other different technology methods to help increase the learning experience. Now, it is time to express our deepest gratitude for welcoming today's speaker, Dr. Kendal Bailey, Director of Nursing Innovation and Strategies at SimX, USA, and for taking the time to be with us today. Her unique perspective and innovative approach have had profound impact on learning. We are incredibly fortunate to have the opportunity to learn from you, someone of your caliber. We welcome you, ma'am. Next, I feel extremely glad to welcome Mr. Joseph Tribble, Director, Relationship, SimX USA. I would like to express my sincere welcome to Karnataka State Nursing Council Observer for this webinar, Dr. Mohini, Principal at SDS TRC RGCID College of Nursing, Bangalore. Your presence here is highly appreciated. We welcome you, ma'am. Next, my heartfelt welcome goes out to our Principal Madam, Dr. Devi Samuel. As our leader, our institution will continue to be a shining example of excellence in nursing education. With Dr. Devi Samuel by our side, we will build our past achievements and forge to the new path for the future. We look forward to the great things that are yet to happen to our institution. Thank you, ma'am, for being a great inspiration for all of us. Next, I would like to extend my heartfelt welcome to our Vice Principal Madam, Dr. Probalis Thomas, for an organizing secretary for this webinar. On behalf of my entire team, I sincerely acknowledge all those efforts that you have taken forward and contributed towards the success of this event and making this such a grand event. Trust me on this, all this wouldn't have happened without your support, guidance, and insight that we got from you. Last but not the least, ladies and gentlemen, it is time to welcome each and every one of you to this international pre-conference webinar. It is a joy to share this virtual space with such a distinguished group of professionals from different institutions, hospital, and industry across the globe. I hope the next hour we are going to have great speakers who will share their expertise on virtual reality simulation, a transformative tool for clinical excellence in nursing. We believe the insight and knowledge shared here will be valuable to each and every one of us. I encourage you to participate actively by asking questions in the chat box, engaging in the discussion, and making the most of this opportunity to learn and network. Thank you. Have a wonderful section. Now I welcome moderator Dr. Sasikala Venkat for this continuing the section.
A warm greeting to all the delegates who have joined us from the various parts of the world and our beloved SimX partners and renowned speaker, Ms. Kendal Bailey. It's my pleasure to welcome you all for this session. Before moving on to the session, I invite our principal, Dr. Devi S., to address the gathering. Over to you, ma'am.
A very good morning and greetings to all the participants for the webinar, and a great evening to Ms. Kendal Bailey from US. And I'm so happy to see Mr. Joseph and other distinguished guests across the globe. I, Dr. Devi Samuel, Principal of KrupaNucon College of Nursing, take immense pleasure to welcome each and every one of you for this pre-conference international webinar. We are much delighted to present the speaker of the day, Ms. Kendal Bailey, Director of Nursing Innovation and Strategy from SimX, for sharing her expertise knowledge on VR simulation, a transformative tool for clinical excellence in nursing. VR is an emerging, powerful educational tool in clinical nursing practice, and as professionals, we always strive for clinical excellence. It's time to embrace the latest technology tools to stand aligned with the professional advancements. As we have participants from clinicals, academics, and community, I encourage you all to be attentive and gain maximum insight from the speakers. I thank the speaker and SimX team and KNC Observer and all the participants for spending their valuable time with us. Thank you, and once again, welcoming you all for this insightful and enriching session. Thank you. Over to the team.
Thank you, ma'am. So moving forward, in this rapidly evolving world, technology has made its way in almost every aspect of our life, including the healthcare sector. Today, as we explore how VR and immersive technology is revolutionizing our training, enhancing the learning outcomes, and improving the patient care, it's my privilege to welcome our expertise in this area of VR, Ms. Kendal Bailey, Director of Nursing Innovation and Strategy at SimX, who will be sharing her insights and experiences with VR in simulation. Kendal Bailey is a dynamic nursing professional with a rich educational background and extensive experience in both clinical and academic settings. She has leadership positions in academic and healthcare sectors, designing educational activities that maximize nursing competence. Her role have focused on utilizing virtual tools to improve educational performance, including 2D and 3D virtual applications. She works with SimX as a Director of Nursing Innovation and Strategy, supporting nursing partners around the world in designing and integrating virtual simulation to enhance nursing competencies and professional development. Her research endeavors have focused on acceptability and framework integration of VR simulation within nursing. Kendal is also passionate about leveraging innovative technologies to enhance end users' experiences and learning outcomes. Without further delay, I hand over the screen to ma'am for her informative session. Looking forward, ma'am. Over to you.
Thank you so much. And thank you everybody for the incredibly warm and wonderful welcome. I'm incredibly excited to be here all the way from Denver, Colorado, working with my SimX partners, and very excited just to share some innovative trends in nursing education. As was so eloquently put, a lot of my research endeavors and a lot of my work has really been around innovative learning technologies, specifically for virtual simulation technologies. So I'm very excited to share this information with you today. Again, please utilize the chat. I always love to be able to get real information from the participants of this team. I know that we have many panelists who will also be sharing their information. So without further ado, I do want to make sure I do disclose that, as had been put, I do work for SimX. I receive a salary from them, and I am a director within the SimX team. But for the focus of today's presentation is I really want to discuss the theoretical entry-level knowledge of what is virtual reality, what do these two tools do for nursing education, and how can we actually utilize them to enhance enhance our learning experiences. I really want to identify how we can use these technologies to meet our competencies to ensure that we have practice-ready nurses. The objectives for today's session are that we are going to describe the concept of virtual reality as an application within nursing education. We're also going to discuss the advantages of VR within the context of andragogy, the adult learning principles. And we're also going to identify applications of VR that can be utilized within nursing education. Before we get too far into the technology, I do want to discuss about what we currently see in many different simulation modalities. High fidelity simulation, role play, standardized patients are often used to help mimic and explore clinical experiences. But with many of these mannequin-based products and with standardized patients and role play simulation, we do find that there are some barriers to incorporating this more readily within our nursing curriculum. So for example, many times we have to have standardized and robust simulation centers that can lead to scheduling difficulties or access denials for people who want to come in and have those simulation sessions. Creating really realistic simulations are very time consuming, especially if we're talking about scenarios that require a lot of moulage or really trauma-based scenarios, multiple patients. That can take a significant amount of time to set up and break down for a simulation group. We also find that with many of these experiences, there is a lacking realism. We can't see those non-verbal definitions of communication. We can't see color changes within everybody's skin. We can't see cyanosis or jaundice. Many of these mannequins are limited in how you can feel for pulses or where you can feel them, really pulling a learner away from an experiential learning process. Often these experiences are limited due to these barriers, and many of these resources are incredibly expensive, not only for the space, but for the medical equipment, hospital beds, and mannequins it takes to really create a realistic clinical scenario. So I want to pause there. And I want you to imagine a world where you could have simulation anywhere. You could use a variety of settings, patient demographics, patient populations, medical equipment, and supplies. You could use varied diagnoses, varying vital signs, and build custom simulations in real time to meet your learning needs. And that's where we get to the place of virtual reality simulations, immersive experiences where you can get realistic simulation with patient encounters to help really ensure that you're meeting the competencies of nursing practice. To clarify some of the terminology that we see, because it does vary by the different technological tools that are available. The overarching umbrella term, extended reality or XR, is really an overarching terminology for virtual reality, augmented reality, or mixed reality. And all of these technologies work by offering digital elements that can create a learning experience to be more engaging. When we look at virtual reality, this is a type of technology where you are actually encountering a 3D or 2D space, and you're actually interacting with objects and providing virtual care. Augmented reality is where you have your real world and you're overlaying it with digital images. So if any of you have ever purchased furniture or bought something online and you were allowed the feature to look at it, see how this looks in your home or see what this might be like in your real space. It's your real space with a digital overlay. That's your augmented reality. And finally, mixed reality is where you have the mix of both worlds, digital and real life. So these might be those technologies where if anyone's ever played Pokemon Go, that might be the situation where you have a virtual Pokemon in real space that you can interact and collaborate with. Or if you've ever gone to your favorite concert and you've seen a musician who's using a digital prop that they're engaging with. For today's conversation, we're going to stick just with virtual reality. But I do want to clarify that there are different terminologies, and these are different software programs that have different learning theories and learning applications. As we look at virtual reality, the first one I want to talk about is 2D virtual reality. And this is where objects or images with only 2 dimensions length, and width are showcased. This is usually often on a flat screen or on a computer. Can be very realistic and you're still providing patient care, but it doesn't give you the 3D or immersive experience that many have come to get used to with virtual reality simulations. Next, we have 3D virtual reality. And this software allows users to visualize an entire space, interact with digital tools. They're able to see above them, around them, below them, and interact with any of the entities that are in that environment. You can see here with one of the images, there's a virtual patient, there's a virtual family member, and there's many different medical tools within the room that that learner can use to help provide patient care. As many of these very realistic simulations can be very engaging and exciting, we also want to make sure as we look at simulation that we are meeting the needs of our adult learners and looking at this from our frameworks from andragogy. So first, we want to talk about how do adults like to learn? So adults traditionally like learning, looking at these several factors. And how does virtual simulation help meet that? So as we look at self-directed learning and guiding towards self-directed learning, these immersive virtual reality simulations allow learners to progress through simulations in real time, take their time or slow down, allow them to make decisions and process through the situation they're dealing with. It also allows students to draw from their personal experiences. Adult learners come with a wealth of personal experiences that then can be applied to the clinical setting. And with these realistic clinical scenarios, they're able to do that. These scenarios are also problem-based, whether that's the critical thinking and actions of dealing with a disease or a diagnosis or a rapidly deteriorating patient. The learner is responsible to go through that process and follow the nursing guidelines to make sure that they're appropriately assessing, analyzing, prioritizing, and intervening to provide optimal patient care. Motivation to learn. Like many of us, we want to have the motivation. We want to feel that it's realistic and meeting our needs. Many of these virtual reality simulations are incredibly realistic, both from our visual feedback, our sensory feedback, and it really provides a highly engaging environment for us to want to learn and engage in. It also meets many different varied learning styles. So whether you are an auditory, visual, or kinesthetic learner, all of your senses can be engaged within virtual simulation, including the opportunity to provide haptic feedback, meaning I could go in and feel the pulses of a virtual mannequin and actually count the pulse rate. It also provides a collaborative learning experience, meaning we're able to work in teams and provide care within that team-based approach, whether that's reporting off to a provider or working with other ancillary nursing services like laboratory or pharmacy, which really is more realistic to the level of healthcare that we see today. So what are the benefits of virtual reality simulation? There is a robust amount of literature out there really looking at the likability and acceptability of VR simulation. And what we've seen so far in some of that literature is that virtual reality simulations actually improve knowledge gain. It also is seen to be more effective than conventional training methods. Additionally, VR simulations provide complex scenarios, which are very user engaging and provide for high-level thought and critical thinking. We also find that VR simulations actually increase the psychological and cognitive responses of learners. There tends to be more knowledge retention. And on top of that, our learners often have more confidence working in this low-risk environment where they can make mistakes without harming patients. They're also very captivating, as we've talked about, and they increase student engagement and student motivation. Many of these articles here, as we talk about the benefits of VR simulation, example here, some of these systematic reviews have really outlined that virtual simulation is as good or not better than many conventional learning approaches, considering more traditional lecture style learning or low fidelity simulation. They've also found that it's incredibly effective within nursing education, provides that self-confidence in students and motivation, and really supports competency development for the cognitive and affective domain learning. Now, I will say, as we look more at the psychomotor competency attainment, our virtual technologies are not quite there yet, but there are many ways to utilize procedure-based approaches to nursing education to really understand the critical thinking and application to patient care. As we talk about VR and all of the multitudes of ways that we can utilize it within nursing education, I really do want to hone in on certain aspect areas. First off, I'd like to look at clinical skills. Like many of us in nursing, we have competencies that we do have to obtain throughout our program to provide patient care. So within these VR-based applications, many of those skill sets or procedures can still be managed through a systematic and methodical approach. Examples being medication administration, ensuring that we're reviewing a patient medical record number, we're identifying that's the appropriate medication, route, and dosage, and then we can actually program that into a virtual pump, making sure it's appropriate to the patient's weight or order and through that right route. Additionally, we can provide patient care and complete full assessments, looking at lung sounds, heart sounds, bowel sounds. We can actually place patients on virtual monitors to be able to look at their cardiac rhythm, look at their blood pressure. Many of these scenarios as well will find that if your blood pressure is low, when you go to feel for pulse rates, you'll also find that your pulse is thready or weak and correlates along with the physiologic responses of your patient. Additionally, you can also find that we can go through many of the basic safety and theoretical components of nursing care, including personal protective equipment, looking at providing wound care, as well as common respiratory-based modalities. Additionally, VR applications can be fantastic for emergency response planning. So as you're dealing with an emergency response, whether that is an adult or a pediatric or an infant client, this can follow many of the international and national standards for emergency response care, including providing emergency medications, using emergency-based equipment like defibrillators, or placing patients on a ventilator after intubation. One of the biggest benefits when it comes to virtual technologies is the ability to provide communication-based training. Many nurses struggle with providing holistic patient care to a variety of developmental ages and concerns. VR training provides that nonverbal. I'm going to go ahead and pause. I'm just going to go ahead and pause real quick and just make sure that we have participants muted there, so then that way we can keep going. Thank you so much. Can provide a variety of communication trainings. So as we deal with our realistic healthcare environments, we do want to make sure that patients are able to provide that holistic experience with communication strategies, whether that's a patient who might be aggressive and escalating in care. You can see there within our first image, a patient who is getting extremely agitated, and how would you manage that within the virtual environment? Additionally, we can also have different demographics and patient populations. So what communication strategies would you utilize for a younger client comparative to an older client? And additionally, there's also a wide range of mental health and psychological disorders that we can manage and work through to ensure that our patients are on that spectrum of the ultimate level of health. As we look at this from the nursing focus, clinical reasoning is above and beyond one of the best benefits here as we talk about those theories for learning and engagement. As we look at these cases here, learners are responsible to get into these headsets and actually go through their critical thinking and clinical reasoning skills. So for example, maybe your patient isn't responding as they should be based off the treatment that you're providing. What's going to be your next step? How do you problem solve that situation? Maybe you have a patient who's starting to have some abnormal clinical findings, as we see with the patient in the upper right-hand corner. How do you manage a patient like that who's having weakness, facial drooping, even slurred speech? Finally, we can also look at the risk factors for patient care and the preventative health needs that we need to include into our plan of action. What is a patient at risk for after a surgical procedure? How can I ensure that they won't have atelectasis or have a wound infection post-recovery? And ensuring we're going through our assessment techniques, prioritizing our interventions, and then evaluating those outcomes as we manage these patient care environments. Another large benefit here, especially as we talk about the engagement for adult learning, is team coordination. So you can actually see over here, you have an image of two learners who are actually working together in the same room within a virtual space. So to engage in immersive environments, we do traditionally use headgear, as you can see, that provides the visual and auditory feedback. And then we have hand controllers that can be used to engage in the scenario and provide that haptic feedback. But those learners can work together to manage a clinical case together as a team. So in this scenario, they're working together to care for an infant who's within the hospital setting. They can communicate to each other in real time, go through and problem solve and discuss the case together, and come up with their recommended actions. Many of these virtual technologies are also not limited to being within the same space. These can be done across very large and vast locations, and you can have learners from a wide area working together collaboratively to care for the patient. With all of this being said, at the end of the day, what does this mean for nursing students, and how do they feel about using these technologies? Often I'm told that there are concerns about actually managing and gaining and using this technology, especially if we're looking at different demographic ages of students. But based off several qualitative studies from nursing students who have engaged in virtual reality simulations, this is what they actually had to say. Many of them said VR actually increased their attention due to that activity and engagement, and they weren't able to zone out. Others really appreciated that it catered to different types of learners as we talk about those auditory, kinesthetic, or visual learners. Also, many students really enjoyed the low-risk environment. That you can fail and do things wrong, and then you're able to learn from that. Many of these scenarios also allow for repetition, which really helps to solidify that plan of action and care that we'd like those nurses to receive. Other students also stated that the environment and everything was so realistic. I can't even express how many times I've had students who've gotten into the headset to complete a scenario and come out and say, I didn't even realize that I was in class or that I had an instructor who was watching me. It was so realistic. I was just engaged in providing that patient care. Other students also said skills training was actually easier in VR, and it was easier for them to learn. Additionally, they also stated that VR skill learning provided fewer stresses than the learning environment, so they were able to carry out the procedures at ease. Many times within simulation, we often have observers or we have faculty members that are watching student interactions during a case, which often makes it very difficult for students to feel like they can fully engage in the simulation. What we found with some of the early research for students who were doing VR simulation is because it is so realistic, they're less likely to be focused on the faculty member who may be watching them and more focused on providing optimal patient care. So that was just a lot of information, really looking at the different avenues of virtual reality technologies, including the initial aspects of learning theories. I do want to go ahead and pause there. I think there might be some questions in the chat. I do want to make sure we have some time for a little bit of dialogue here. Are any of my moderators, or do we have any chats, questions within the chat box that we're able to answer?
No questions yet, ma'am. I'll start with my own question.
Please do.
So I just spoke about XR, ma'am, the mixed reality. Is it already integrated in nursing, or it's just in the starting phase?
I will say for nursing education, it's very much in the starting phase too, still. And a lot of that really has to do with the headgear and how affordable it is. So to really get into like mixed reality or even augmented reality approaches, you have to have headgear, like that Oculus headset, that actually has a camera on it. So that way it provides the feedback or that digital interaction. So as of right now, that type of headgear and interaction is not as affordable, which doesn't make it as easily integrated into nursing education. Do I imagine that that's where the technology will go? I do. I very much imagine a world where we're utilizing our standard simulation spaces, stretchers or hospital beds, and then they're overlaying with digital patients that we can care for. There are some softwares out there that are really starting to investigate that, but I would say it's still very early adoption as we looked at more mixed reality or augmented reality usage. And a lot of it's really leaned into that immersive environment due to the cost of the headgear.
Which, according to you, would be the best, VR, AR, or XR?
It's a hard question, right? And I think the biggest thing is it really depends on what your learning is. I would say for a pre-licensure student, and you really want to ensure that they're meeting the competencies of your curriculum, having a very realistic environment that has ease for them to use, it just makes the learning curve and the technology adoption a little bit easier. So I think when it comes to what I have found as the constrictions on resource, space, setup, and the amount of time I'm trying to use simulation in pre-licensure programs, having an overarching, encompassing, immersive environment has been much easier for me, because even with mixed or augmented, I'm still going to have a space that is either realistic, or maybe I have the supplies that they're going to be utilizing, which then doesn't always afford me the time that I like with the immersive space.
Thank you. There's another question from Dr. Devi ma'am. Ma'am wants to know any other emerging trends in training nursing students?
I will say a lot of what I've seen in regards to training nursing students is really looking at that scrambled approach. So utilizing reverse case studies, evolving case studies, finding ways for students to really look at that overarching critical thinking, clinical thought is really what I've seen as a lot of the engagement there. And so as we look at the new technologies, I will say from my perspective here in the United States, computer-based applications, computer-based trainings really became very mainstream during the COVID-19 pandemic. And I think now we're just including more immersive, realistic environments that again help with some of the constraints we have for resources of faculty, time, and medical equipment.
Ma'am, we have one more question from Dr. Prabha. Ma'am's question is, how do we ensure that VR simulations are realistic enough to effectively train our students and provide hands-on experience?
That is a fantastic question. So I always like to start with, as of right now, early literature for VR has really focused on, like I said, likability, acceptability, student engagement, student motivation. There is still some studies that we really need to look at for longitudinal program-based learning. All in all, but we are seeing that virtual reality simulation is very similar to mannequin-based simulation in regards to the outcomes of learning engagement for students. Now, the limitations for virtual reality simulation are that they are not very good for psychomotor learning domain because the technology is not there. So if they're engaging in the simulation and they have to place an IV catheter or a Foley catheter, they're just using the hand controls, right? It's not the same tactile experience of inserting an IV catheter. What I love to do in those cases is mix or blend my simulation. So often what I do then is I will have a low fidelity task trainer to do the Foley insertion, to do the wound care, to do the IV insertion. That might be half of my group. And then the other half is going to go ahead and engage in that simulation to really understand that critical thinking pathway. Why am I putting the IV in? What am I seeing from my patient that they either need those IV medications or they need that fluid? Why am I going to go ahead and insert that Foley catheter? What are my concerns for the Foley catheter? So I really like to blend those two because the technology is not there for the psychomotor piece. There are some, and I think this will probably take a little bit longer than what I really kind of see coming down the pathway for more mixed or augmented reality, is they are trying to come up with more tactile-based gloves or hardware that really gets into that fine detail of the psychomotor learning domain. But again, it's just not there yet. A lot of those gloves being incredibly expensive also really don't mimic. What they do is they kind of force the hand to open and close to give you the grasp, but it's not the same as you would feel as you're doing a psychomotor based learning. So that's where I'll really lean into what I see from the literature. It's that it's cognitive based and very effective domain based. And then I like to blend in the psychomotor pieces for those psychomotor competencies, so that way I can meet all of those learning outcomes.
So it would be a mixed learning is always a best.
Hey, you know what? I would say I've loved to add it into the toolbox of simulation. I think what I see consistently is that simulation and VR simulation are exceeding above and beyond conventional training methods. So when it comes to lecture-based training, above and beyond that is very well versed in many of those systematic reviews that I have within the presentation there. But again, I think it really comes down to what is that level of learning and the competency that you need to meet. When I talk about managing therapeutic communication, working with mental health or unpredictable patient behaviors, escalating patient behaviors, understanding clinical pathways, looking at comprehensive patient care, I do think that there's a very big benefit for virtual reality-based simulations, far and beyond kind of what we've seen with some of our others. But I think that there's low task trainers, again, that could be really beneficial for some of those finite skills.
Now we have one more question. How can the cost of VR technology be justified in educational setting, especially when the budget is tight for an institution?
You know what? I will say the budget is very tight here in many of our US academic centers, especially for the restrictions. I will say I would look at what those overarching costs are to really look at what the comparison is. So for example, if you're going to look at high fidelity mannequin-based simulation, traditionally those mannequins are going to cost you anywhere from, and again, I'm using US dollars, but about $75,000 to $100,000. And traditionally you'll pay for a warranty package on those of about $6,000 to $8,000 per year. So that's just the mannequin. That's not the hospital space or the oxygen equipment or your medications or syringes or bed linens. That is just to make the space look realistic. What I do find is that a lot of institutions are partnering together because you have those remote capabilities to work your resources amongst a larger geographical area. And I've seen many institutions actually come together for funding if they can, so that way they can share the resources of virtual technologies and start to slowly grow their program. But there are several actually literature pieces out there that talk about the cost advantages now of VR technologies because the headgear has become so much more affordable than it was even 10 years ago, significantly cheaper than what we see for the cost and maintenance of some of the high fidelity based mannequins.
And there's one more question. How the virtual reality will be helpful in communication between a nurse and a patient during therapeutic care?
How can?
Should I repeat?
Yes, please. That would be fantastic. Thank you.
So it's a question by Delegate Suma. So her question is, how the virtual reality is useful in communication between nurse and a patient during a therapeutic care?
That's a fantastic question. So how is it helpful in the fact that you are actually hearing both the dialogue features as well as seeing a lot of those nonverbal communication strategies? So besides I'm angry, right? Many of our mannequins are keeping the same facial tone as they say that they're angry. Whereas in a virtual environment, you're actually seeing that, you're seeing the physical enlargement. They are pulling in closer to you. You actually feel the physical space of what you would if you're talking to somebody on the other end. So we do have simulations that are built with multiple dialogue options. We also are similar in the fact that, I'm not quite sure why that went there. Is someone pulling up a whiteboard? Okay. Also similar in the fact that you can actually speak to your users in your headset through a microphone option, just like you would with your high fidelity based simulation. So you can provide and answer many of those dialogue options, just like you would during that communication base. And so what I see is virtual technology has the capability to have your patient cry and scream and have flat affect and sit back. Whereas we don't traditionally see those capabilities unless you're using standardized patients that are well trained, which do have an additional cost of their own to have standardized patients.
That answers the question. Ma'am, we have one more question. What is the role of andragogy in problem-based learning and how it would solve?
How virtual simulation would solve problem-based learning?
The question is on role of andragogy. Andragogy, I think that's a
for
learning-
adult learning theories. Yes.
learning in problem-based learning and how it would enhance learning.
So great. So looking at that, so as adult learners, traditionally we want to have experiences that are motivating to us, that meet our learning styles, that are applicable to what we're learning and why we're learning it, and can pull in and have those problems that I have to go through and solve so I can deepen that experience in that learning process. So for virtual simulation, where you're engaging in an entire virtual space, I have a very highly visual, I have the auditory input, I have the tactile input from the controllers and that haptic feedback to engage all of my senses for learning. I also have learning that is applicable to my role as a nurse. So I can actually see if I have to insert a Foley catheter for a woman related to, let's say she has an epidural during pregnancy prior to delivery, I can now ingrain those thought processes to my nursing practice. If I have a patient who escalates with me and I have to showcase de-escalation skills, and I've done that, I can then translate that into my clinical practice. So that translation of my actual work, because of its very realistic environment to what I'll see in clinical settings, really highly supports that learning and that engagement from your student. Additionally, because of those problems, you're working through that pathway, right? You get patient reports, you'll see the patient demographics, their lab works, their medical records. Why are they in the hospital? Well, now, how are you going to care for them? Maybe you have a patient who just came back from a procedure and has a chest tube in, and all of a sudden they start to have respiratory distress. What do? You care for a patient who is a diabetic and you go ahead and check their blood sugar and it is low. What's my next step? And there's nobody else in that space besides either your peers, or if it's a guided simulation experience, it's your responsibility to solve that problem, which then really engages your learners into what they're doing and how they're engaging in that case. So not only are they seeing, I'm going to grab my glucometer, I'm going to actually get the blood, I'm going to check what the blood sugar is, it's low. Now what I do, I need to go look at my medications. I need to make sure that those medications are accurate. Can I give them to my client? Is the appropriate timeline? All of that is happening within the simulation at one time. I also really like, for many of these simulations, the ability, again, to be remote, but also be recorded. That self-reflective practice for adult learners to be able to watch themselves, review their actions, go through those frames of why did I do this? Why did I make that decision? Oh, no, I didn't do that. Maybe I did do that. Having the ability to record and review the teamwork, the engagement, the communication strategies, I also think are very beneficial to learning and how students can see themselves in action, providing patient care.
Now we have one more question by a delegate. Will AI replace nursing care in near future?
I will say I love that question. I absolutely love that question. Here's why. AI is great. AI is fantastic. And so AI is when we talk about different technologies, AI gives us a greater tool for patterns. It's fantastic for analyzing data. It is not great for understanding us as humans. So when we look at AI, if I were to look at it and, I'm looking at those algorithms and I want to say, hey, I have this data set. I want you to tell me, right, what's my financial output? Yeah, it's going to do that really, really well because there are specific formulas that you use to analyze that data. AI does not have the ability to walk into a patient's room and to be able to assess the nonverbal, physical, environmental, emotional, mental, physical interactions of patient care. It can't collect all of that to come with output. It says, I have patterns, I have this basic set of formulas and information, and I can bring them forward. Now, where I think AI will be very beneficial in nursing education is in human language and the ability then to have more realistic communication without having to leverage another facilitator. So for example, getting to a place where you can run a simulation and you have a moderator, maybe a moderator is there to support multiple groups, but at the end of the day, you have AI human language to keep up with that dialogue. So I think actually that AI human language component is what's going to come in as an advantage to nursing education to develop those communication strategies. But right now, no, I don't think that AI will take away from nursing. I think if anything, it's going to help us as a clinical indicator, help recognize patterns in patient care. But I think what I love about nurses, and probably many of the nurses on this call, is we are highly respected because of our touch, our physical engagement, the nonverbal we see from each other right now. And that's what makes nursing very, very special. And there's no way a computer can mimic that. And I say that working in telehealth and doing telehealth visits and utilizing technologies in healthcare, it's just a different patient engagement. And that's not, I think, the art and the love of nursing. So no, I don't think AI will take my job, but it might help me create more therapeutic conversations.
I do agree with that, ma'am, since I think nobody would like to get care from a technology. It's always good we receive a care from a human touch.
It is. And I think that's what a lot of virtual simulations can provide, is the human touch of being able to see somebody cry, right? And be able to be there for them if they are scared and they are alone, because we are that bedside component, that bedside caregiver. And so I think when we talk about nursing, especially in a very highly acute healthcare environment, our patients are more complex, they come with more disease processes, but the art and I think the core element of nursing is just highlighted in these virtual simulations because of all of the ways you can really interact and help a student interact through those processes.
Yes, ma'am. We have another question. How can a nurse embrace nursing care in future in relevance to AI?
So I will say this. I think technology adoption for anybody is difficult. Because it's a new process in how we practice nursing. Even when we look at how we practice nursing 10, 20, 30 years ago, it's changed significantly. But with every change, there comes with apprehension. Now, I will say for me, I was in a nursing place where we went from paper charting to electronic charting. And I remember to that day being terrified that the entire world was going to end because I had my paper chart and what was going to happen if my paper chart was gone. And now if we have a computer that goes down and they'll give me paper to chart and I'm like, no, I want my computer back. Like, I need that back. That's how I know how to chart in many of what we see here in our nursing structures. So technology adoption is hard and change is hard. But again, I think if we hone in on what we want to see for nursing practice, highly competent, highly engaged, holistically centered individuals that are looking at patients from a variety of ways, I think that's never going to change. But how we get there is what's going to support us and how we provide more optimal care having better diagnostic tools, having more resources so we can get to patient care faster. I think that's the benefit of technology. And so as much as you can, even for me, trying to get in and understand it a little bit more has helped with my own fear in adopting technology, because then I understand where my role is still very much in that same essence, but this is actually a supportive tool for me so I can provide better care or more optimal care.
And there's one more question. What would be the gross cost of an educational institution to install this simulation technology? I think the VR simulation.
Always a wonderful question. So I will always say, go back to the companies that you're working with for what you need. Many of them have different structures for cost. Some of them are by student. And so depending on the scale of your program, you actually pay a per student cost for these softwares. Other companies, it may be by the institution. Many companies, as you look at what that hardware is, that headset, that can, be way more affordable depending on what kind of level of engagement that you're looking for. So I will say, when you look at the cost, it really is going to depend on how many students, so the size of your institution. And if you go with a company that is more institutionally based or student based, and that's where, when we talk about 2D and 3D applications, some companies make products that are 2D only, so only on a computer. Others make just 3D, immersive, and then you might have companies that offer both. And so all of those are going to come with different cost parameters with those. What I will tell anybody is, if you are learning to adopt some of these new technologies, start small, identify your champions, really hone in on the skill of providing that level of simulation, and then grow it. So work with those institutions that help really create tailored packages or support systems for you. So that way, as you get over that technology curve and understanding how your students can use it and how you want to integrate it into your curriculum, I think that is where I see the biggest benefit. So cost is hard to say because there's options out there. I will say that there are companies that are definitely more affordable. But again, it's going to depend on how you want to utilize it within your institution. So unfortunately, I can't give a very specific quote. That's a very personal, based off of how you're going to use it and how much. But I would say, at least for SimX, I know Joseph is a great contact if that's someone you want to get a quote from, or do some demos, or look at information there. So that way you can make a really informed, appropriate decision for what works for your institution.
There's one more question.
I love it. This is great.
Oh,
I should have just done this all night.
I have to wind up also. So how do I join SimX if I'm a nurse?
Come hang with me. I'd love it. Please come join us. We need as many nurses as possible. No, I think what I love is, and Joseph will say this too, what I love about VR right now is some of our biggest consumers are nurses. Like, nurses are owning this work. Nurses are owning their education. They're owning these new technologies. As much as we talk about being scared of it, nurses are the first ones to get in there. So I will say, if you are really engaged in using virtual technologies, come in and at least try and demo it. See how you feel with it. See how you can align it to your programs or for your learning. Because I think that's the really creative, fun way to say, yes, this is how we can get to better learning outcomes. And of course, Joseph can always connect you to me. I always love working and blending with other amazing nurses internationally. I think that's what makes nursing so wonderful. But yeah, I would say, if you're already wanting to look at SimX for nurses, go ahead and start to get into some headsets so you can really see what a virtual environment is like.
There's one more question as to any studies to compare the cognition between VR and traditional methods.
I'm so sorry. I did not hear that question. I think there was a little bit of background noise.
Yeah. Before that, I request all the delegates to kindly mute.
Thank you.
Yeah. So the question is there any studies which basically compares the cognition development between the VR and the traditional methods for training nurses?
Yes, there are several systematic reviews out there actually in my slide deck, and I know Joseph can share some of those articles in there that actually look at that cognitive attainment for VR to conventional. So that's where those benefits of VR information I had actually came from 3 different systematic reviews on looking at the effectiveness of virtual simulations in nursing education specifically. I will also say there are other larger scale studies too that look at virtual simulation for healthcare technologies. But for this discussion tonight, I really did focus on the nursing perspective. And again, the literature is going to say cognitive and affective domain learning are great. Psychomotor, it's just not, but I think that's really related to the technology. So that's where I love blended or fitting in different ways to meet those objectives, those competencies, so that way you can really get that really global overarching outcome.
Yes, now there's another question. Considering the cost in the institutions in India, is there any single headset to see or experience more content or more scenarios?
Yes. So, you know, I will definitely look at Joseph there too, but there are many actually out there on the public market. Oculus, I say the Oculus just because that's the one at this point in time that is the most cost affordable for headgear. And they have different generations too. So there's an Oculus 2 that's been now updated with the Oculus Quest 3, but really those are, you know, they still have very good imagery, they have good auditory feedback, but that's where you can pick the headgear that's right for you. Now, there are programs out there that have more costly headgear, but that's where you get more into the cameras and looking at augmented reality, and if that's something you want to start to invest in. But I would say, yes, what I've seen actually many institutions do is actually start with one headset and demo in trial cases and figure out then, well, what cases do we need to fit our program? Are we really needing pediatric cases? Do we really need geriatric health cases? Do we need more inpatient or clinic cases? Women's health. And so then they start to really identify, well, how do we want to build this in? Let's talk about this as a faculty group, and then you can demo those and work those out as a group.
Yes, ma'am. This last question, which digital elements are used in 3D virtual reality in care of the patients?
I'm assuming just by the digital elements, that might be tools that you can interact with within the virtual space. Actually, many of our simulations, at least for SimX, there's a variety of tools for the cases that are relevant to the patient care. So we actually have some cases where you can have an X-ray done, and then that X-ray image actually comes up in real time that you can look at for your patient to provide patient care. We have chest tubes, IVs, PCA pumps, patient-controlled analgesia. We have ventilators, we have defibrillators, we have transfusion equipment, we have blood administration supplies. We go all the way down to non-skid socks, armbands, glucometers, hospital beds, infant warmers, a range of respiratory equipment. So the tools will align to that type of patient care. We also usually have a custom set of like tools that are in every single case. So every single case, there's an IV. Every single case, there's IV fluids. Every single case, there's that, you know, glucometer or alcohol pad or gauze, gowns, blankets. And so that way, those kind of essential elements of care will always be, but each case may be built out to what's needed for that scenario. So if it is an emergency response situation, traditionally we'll have an emergency cart, emergency medications, a defibrillator, maybe a ventilator, maybe a 12-lead EKG machine. It would just kind of depend on that case. But that's where, when you talk about the cost of getting all of those tools in real life, it helps to have the virtual version of it, and then you can really get into the tools of healthcare.
So we'll wind up with a Q&A round. Next, I would like to invite our KNC observer, Dr. Mohini ma'am, to speak few words. Over to you, ma'am.
Good morning, all. I first of all congratulate Miss Kendal Bailey for her excellent session on applications of virtual reality for increasing the competency of nursing students and nursing practitioners, both in simple and complex procedures and activities. And she has given all the clarifications and answered every questions of the participants with the good answers and applicability also. And I wish all the colleges to use the new technology for giving the education to the new learners and the nursing students for their good practitionership. And on behalf of Karnataka Nursing Council, State Nursing Council, I thank Ms. Kendal Bailey for her vision on the development of nursing profession. Thank you, one and all.
Thank you very much.
Thank you, ma'am. For my personal, really, it was a great informative session. Thank you for the informative session, ma'am. Now I request Professor Uma Parvati, ma'am, to give a vote of thanks.
A very good morning and good evening to everyone. Thank you is such a prayer that cannot be seen or touched. It must be felt by heart. First and foremost, let us thank God for the success of today's webinar. We are grateful for His guidance and blessings that have made this event possible. On behalf of KrupaNucon Group of Institution, Management, Principal, Faculties, and Organizing Team, I am Professor Uma Parvati from KrupaNucon College of Nursing. It's my privilege and honor to extend my heartfelt gratitude to all of you joining for this webinar today for this enlightening webinar on virtual reality simulation, a transformative tool for clinical excellence in nursing. It's been an incredibly informative session and we are grateful for your active participation. I would like to express our sincere appreciation and gratitude to our distinguished speaker, Ms. Kendal Bailey, Director of Nursing Innovation and Strategy at SimX, and Joseph Tribble from SimX. Your insightful presentation on the revolutionary impact on virtual reality in nursing has been both inspiring and educational. Your expertise has provided us with a clear vision of how technology can elevate clinical training and practice to new heights. We are profoundly grateful for your time, effort, and willingness to share your experiences and knowledge with us. Once again, thank you, Ms. Kendal Bailey, ma'am. Thank you so much. I'd like to extend my thanks to Dr. Rogini, SDS, TRC Principal, and Rajiv Gandhi Institute of Chest Disease College of Nursing, as an observer from Karnataka State Nursing Council, for your valuable time and presence here and supporting our college in the smooth conduction of the webinar. Thank you, ma'am. I'd like to extend my thanks to our moderator, Mrs. Shashikala, Assistant Professor and HOD of Community Health Nursing Department. Your guidance throughout today's session ensured that the session was engaging, informative, and highly relevant to our audience. Thank you, Shashi. A special thanks to our beloved principal, Dr. Devi Samuel, for your visionary leadership and meticulous planning in organizing this webinar. Your guidance and support have been instrumental in making this event a success. Thank you, ma'am. I'd like to extend my heartfelt gratitude to our Vice Principal, Dr. Prabhalis Thomas, for your unwavering commitment to advancing nursing education and your continuous efforts in providing such platform for learning and development are truly commendable. Thank you, ma'am. We are also deeply grateful to our management, KrupaNucon Group of Institution, Director, Dr. Samuel Isaac, Academic Director, Dr. Raman, for their immense support and encouragement in conducting this webinar. Their dedication to fostering an environment of academic excellence and continuous learning is highly appreciable. A big thanks to our participants, especially the faculty, students from various institutions who have joined today. We extend our heartfelt thanks to everyone. Your enthusiasm, insightful questions, and active engagement by your presence and participation have made this webinar more dynamic and fruitful. Your contribution have significantly enriched today's webinar, and we hope you have leave with valuable knowledge and inspiration for your own practice. Next, I would like to thank Mrs. Liju Krishnan, Associate Professor, HOD of Mental Health Nursing, and Mrs. Rajeshwari, Lecturer, and Mr. Nikhil from SimX for their diligent effort in handling the registration and providing logistical support. Their behind-the-scene work has ensured the smooth execution of this event, and we are thankful for your hard work and dedication. I also would like to acknowledge and thank all the faculty members of KrupaNucon College of Nursing for their enthusiastic participation and support. Your active involvement has significantly contributed to the success of this webinar. My sincere thanks to our technical team, volunteers of organizing team, whose behind-the-scene efforts ensure that everything runs smoothly. The dedication is truly appreciated. Lastly, I'd like to acknowledge the hard work of the organizing committee in making this event a reality. Your commitment and teamwork has been instrumental in the success of today's session. Once again, thank you all for being part of this successful webinar. We look forward to your continued support in our next webinar series and future events that continue to provide valuable insight and learning opportunities for everyone. Thank you. Have a wonderful day.
Thank you so much, Ms. Kendal. A very engaging and insightful session and an eye-opening session. Really, we got a very elaborate information on VR. You made it really simple for the learners. Thank you so much. A heartfelt thanks from our institution, and we look forward to have more and more sessions from you. And once again, thanks to all the participants. It was very good webinar. I hope it would have been a very useful for everybody. Thank you so much.
Thank you. Hopefully I can come out and travel and meet all of you. You've been absolutely incredible, and I was so honored to be able to speak with everyone tonight. So thank you very much.
Thank you, ma'am. Ma'am, Dr. Mohini ma'am wants to address about the points. Over to you, ma'am.
Okay, once again, good morning. I am pleased to announce 2 credit points for the session from Karnataka State Nursing Council for the participants. Thank you, ma'am.
Thank you, ma'am.
2 credit points. Yeah, I hope one more session is there. So
Yes,
for
ma'am.
half day, it is 4 points will be given. Okay, thank you.
Thank you, ma'am. We, for all the participants, we also have another series on 23rd by SimX XR. Please join us on 23rd. And I would like to end this session with a note thanking everybody for joining us today. Yes, ma'am.
Okay, excuse me. So
Yes,
it is, this session is completed, ma'am? Is it completed?
Yes, we are going to end now.
And so one more session is not there.
23rd.
23rd we have.
One more speaker is there, no?
One more speaker on 23rd, ma'am.
Okay, so it will be 4 points, ma'am. Then it is not 2 points.
Okay, ma'am. Fine.
Okay, 4 points. 4 points from KSNC. It is 4 points for the session. Okay, thank you.
Thank you very much, ma'am.
Thank you, ma'am.
No. Thank you.
So, ending note, thank you everyone for joining us today and contributing for such a vibrant discussion on integrating our virtual reality into nursing education and exploring the ways we would definitely try to inculcate or integrate VR into our nursing education since it is at a very seedling process in Indian scenario, we will definitely look forward to make it happen. So as we move forward, I encourage all of you to explore how VR can leverage within our institutions. And whether you are a seasoned educator or new to technology, there is always something new to learn and ways to innovate.